the whatsoever problems are there. Now let us see how these guidelines are made. Initially they are giving for what the guidelines are made. The important thing is that this, we call it as a International Society of Hypertension, so it is abbreviated as ISH. So why these are there? They have made it in two formats. One is essential and optimal, means which is the compulsorily which should be there, and what are the optimal, which are the best in that situation. And you can see the table of content over here, that it guides you about various things. It includes even the how to measure the blood pressure and how to diagnose hypertension, what are various things are there, what are various risk factors are there, and what are the consequences like organ damages, exacerbations and there, and what can be the treatment in these conditions. So let us see one by one about it. So these are the classification we have seen earlier. These are various classification, and on various basis, on the from various societies they have made these criteria to what we'll call as a normal blood pressure, to what we'll call as a high blood pressure, to what we'll call as a grade 1, grade 2 hypertension. And accordingly, what once this gradation is there, on that what we'll be doing accordingly. Then next is how the blood pressure should be measured, because you must be knowing that even the changes in the environment or ambience can causes changes in the blood pressure, and therefore there are guidelines what it has to be done. It should be commonly on the basis, or on that blood pressure measurement only we are categorizing the people whether they are having hypertension or not. So see what are the condition it should be. The room should be quiet. Before measurement, no smoking, no caffeine, no exercise should be there before 30 minutes. Then the bladder should be empty, because it will change the volume. The person should be remain seated and relaxed for around 3 to 5 minutes before that. Neither patient nor the staff will talk before that, during and between the measurements. The positions should be sitting, the arms should be resting on the table, and the mid-arm at the heart level. Back should be supported on the chair. Last year we have made these blood pressure measurements. And device, there are various measurement devices are there. There are many devices are there, and they are time to time validated. Then how the cup should be there, and what it should be there. At least during each visit takes 3 measurement with 1 minute between them. So it should not be too late, it should not be too early. Calculate the average of last 2 measurements, and if the BP of first reading is less than 130, 85 mm, no further measurements are required. Blood pressure of 2 to 3 office visit, if it is having more than 140, 90, then it indicates hypertension. So this is how the guidelines are there, how it should be measured. You can see the picture over here. It can be there, no talking, the person shooting upright, back is supported, no talking during that, cuff is fit to the arm side, okay, arm is bare and resting. And this is electronic machine. We have seen it in manual or mercury type of oscillatory devices. Here both the job are done by machine itself. It causes the pumping of air and measurement. So these are the electronic machines. We have seen it in that. And these are all the directions and how it is done. Then once we have seen that, then one more type of hypertension is there, that is called as white coat and mask hypertension. That is, these are actually problem is whenever the blood pressure is measured, or some doctor or nurse is measuring, then at that time their blood pressure increases. So this type of thing is called as a white coat hypertension, and these subjects are having intermediate cardiovascular risk. They are actually between normotensive and sustained hypertensive, and therefore it has to be checked repeatedly and verified. The mask hypertension are at similar risk of cardiovascular event. Mask means the hypertension is not coming when it is measured. At that time it is there. So whenever they are visiting, their hypertension looks normal. It appears to be okay, but actually they do have hypertension. So these are the situations. There are two totally different situations, and these are very important. So actually, they do not need any treatment, but they need a care, and it can be verified earlier, so that this masked one particularly it's not becoming dangerous. Now, what are various risk factors? There are many risk factors, like history of cardiovascular diseases in the family, then any kind of cardiovascular diseases, psychological diseases, stressful diseases, then various kind of habits like smoking habits, alcohol habits, and such. All these things, these all are various risk factors, and these are to be checked. So overall cardiovascular risk has to be checked. Then what is the position of what are the situation of the cardiovascular situation, how the heart is doing the job, it has to be done, and then accordingly all this assessment is done. What is the physical examination? You must be knowing that there are many tests are there for heart, particularly stress test. People are asked to run on the treadmill, and then accordingly ECG is taken. So accordingly all this, and hypertension is also measured, or this is blood pressure is also measured. ECG is done, blood tests are done, urine test is there, 12 lead ECG is taken, and echocardiography, etc. All these are done to check whether any other. This is after diagnosis of hypertension. What are the reasons? Because we know that hypertension can be secondary also. So check the things for the secondary hypertension, and once it is there, then you get the clear diagnosis. Then make the picture clear. Now those who can try, you can read in book, because it is a practical aspect. We call it as a SOAP analysis. Whatsoever case comes to us, what we do is we call it as a SOAP analysis. S means subjective, that is for what the patient is there, what are the symptoms, that is okay, these are all, and what are the other details, age, sex, etc. Objective means what you get, or what information you obtain from that, and on these two bases you go for assessment. That is what it can be, what kind of problem it may be, and then on that problem, particularly in objective, some of the other information which is relevant for the disease, they are obtained. It may be related to symptoms, it may be related to further investigations. So this you get it in objective, and then you go for assessment. This assessment again, you can add some additional diagnostic tool. You go for mental assessment, that what is the condition, and all after assessment, then you go for planning. That is what kind of treatment is essential, what kind of guidance. So it is not only drug, what kind of drug, what dosages, how much time, then what other things, what are the dietary or other restrictions, everything you are putting there. So this is what situation is, we call it as a SOAP format. This is what you will get in practicals. In practical, when you will get cases about, suppose, hypertension, this case may not be described in SOAP format. You have to convert it into SOAP format. So you get all this information, and if required, then you go for all these additional diagnostic tests. If hypertension is there, to find out two things you find out in the diagnosis. One is what can be the reason, whether it is a secondary hypertension, or what can be the consequences of the hypertension, whether this hypertension has led to any kind of damage to whether arteries, kidneys, or any important organs, brain, etc., and or heart, what are the changes are there. So these are the diagnostic things, not only for hypertension, but what are the consequences of hypertension, you are going for it. Then, as I told you, while checking, you go for various risk factors like age, it can be other things, and all this. Once you get all this information, then you make it a picture, you summarize it, because this is all detail you have obtained as a subjective, objective data, and some of the data you added during assessment, and all this data you are using for the planning, because without sufficient and proper data you cannot plan the proper treatment. Now, what can be the consequences of this? See, example, we have got various risk factors. Okay. Now, simultaneously, person is having, see, what is the situation? Person is not having any risk factor, maybe smoking or any other things, or genetic, this one that parents are having. So these are various kind of risk factors. Either it is a genetic inheritance, that one or other parent or both parents are having hypertension or cardiovascular disease is one of the risk factor. Diabetes is having one of the risk factor. Smoking habits, alcohol habits, then sedentary lifestyle, increased body weight, obese weight, then hyperlipidemia. There are many such kind of risk factors. So out of that, there is no risk factor, and the person is having blood pressure between 130 to 190, or diastolic is this, we call it as a high normal or toward just slightly higher. So we'll say that the risk is lower. But if it is there 1 to 2 risk factor, then it has got still lower, but comparatively chances are there. But if there are more than 3 risk factors are simultaneously been there, then it becomes a moderate risk, because blood pressure is also there and risk factors are also there. Now pressure is there and more than 3 are there. Example, chronic kidney diseases are there, which is of grade 3. Diabetes mellitus is there simultaneously. Then these people are for very high risk or high risk of having this. So similarly, this chart shows that at different blood pressure and different risk factor, what can be the risk. So those which are having very high blood pressure and having maximum risk factor, they are having very high risk of cardiovascular damage or other organ damage, vital organ damage, and therefore they need to be treated, they should be treated in a good manner, and so that continuous watch, continuous observation should be there. Now, what are the impacts of this in brain? Examples, stroke or transient ischemic attacks are there. TIA means transient ischemic attacks. Why these are there? Because blood supply to brain is reduced, and therefore patient is confused or maybe fall down or syncope. There are variety of situations are there. So it can be judged, it can be checked with the MRI or various diagnostic things and checked what are there. In heart, we have got many tools. ECG is there, then echocardiography is there, then stress test is there, then kidneys can be checked, and arteries can be checked with various activities. So once we understand the situations what are there, then what are the eyes, fundoscopy will give whether the eyes are proper or not, or there is any hypertensive retinopathy is there. So these all are there. This we are going to check, because of, as I told you, there are 2 things for which we are diagnosing, we are making diagnostic. There are 2 things. One is what are the consequences of hypertension, and second thing is what can be the reason behind hypertension. Both are important. If we understand what is the reason or what are the diagnostic feature, what are the important features, then it will help you to understand treatment, what treatment you can make. And another one is hypertension mediated organ damage, that will help you to understand. And that will help you to understand what are the hypertension mediated organ damage, because the hypertension can damage many organs, and therefore this all test, particularly those who are having higher blood pressure, we have to go for that. Then there are certain drugs which can cause it. Example, NSAIDs, that is non-steroidal anti-inflammatory drugs, or very commonly we call them as a painkiller. They are very commonly used. So these are responsible in some cases, okay, causing blood pressure. Example of this is celecoxib, can cause slight increase, that is up to 3 to 1 millimeter of mercury. Then some other non-selective can also cause around 3 to 1 increase in that, that is not big one. Aspirin do not cause, and other are not making much. Then oral contraceptive pill, they can cause quite high increase in blood pressure, example 6/3, that is 6 systolic, 3 diastolic, and with high doses of estrogen content it can be there, and with progesterone it is around 1 to 4. Then antidepressants, they can also cause it. Then acetaminophen, that is paracetamol, can cause it slightly, not big change. Other medications like steroid, they can cause quite big, therefore they are called as a glucocorticoids. They increase blood glucose and even they causes the increase in blood pressure. And herbal and other substituent can be there. Example are alcohol, mahung is ephedrine, you will study it in pharmacognosy, and other such agents, St. John's wort, yohimbine, they can cause increase in the there. One more thing is there, during season also there can be increase. When common cold is there, then slightly increase in blood pressure can be seen, while when there is a hot atmosphere, because it causes vasodilation, and therefore blood pressure can be slightly decrease in that. So that has to be checked. Then what are various pharmacological treatment? We know that we have got many drugs available for that, and accordingly we have to go for various treatments. Then important is lifestyle modification, how what we can do in that, what are various lifestyle modifications. So these are very common one that are called as a salt reduction. It is very common, most of the doctor advise this. Then this particular thing is there, that is when you there in Ayurveda, people say that instead of this common table salt, go for the rock salt, that is called as a Sindhav namak in Hindi, or Sindha namak in Marathi. So people say that that is comparatively better. There are many other things, but it is always good to reduce salt as far as possible. Avoid or consumption of high salt foods, including soya sauce, fast foods, and many foods material, they are having high salt content. So, or wherever sodium content is high, even though it is not sodium in any form should not be there. Then healthy diet should be prescribed, and for that very typical concept is there, that is called as a DASH diet. So whenever hypertension is there, always people prescribe that is called as a DASH diet, that is dietary approaches to reduce, that is to stop hypertension, that is. So that is known as a DASH, dietary approaches to stop hypertension. And this DASH diet, that causes that is more vegetable, lesser salt, less sugar, and this particular DASH diet is there, which should help the people to reduce the calories, and because of that obesity and all other factors which is there. So it can be, these are less in salt, less in sugar, less in oils, and more in fruits, more in vegetable, more in easily digestible material, high in nitrates. So these are various material are there that can be taken. Then alcohol consumption, healthy drinks. Next is the people should go for healthy drinks. The coffee, green and black tea should be only moderate, not much, even though people say that they are antioxidant or anything, but yes, they are stimulant and can cause. Other beverages that can be beneficial, including the this hibiscus tea. Hibiscus is a plant, jaswand we call it as a. Then pomegranate juice, then beetroot juice and cocoa, these are better one, they are helping. Then moderation of alcohol consumption. As I told you, alcohol consumption is one of the risk factor. It should be as minimum as possible. Smoking cessation is important. Regular physical activity is important, and it can be done as per the guidance of the experts. Then reduction in the stress, and including in the mindfulness or some happiness, because more stress that results into hypertensions and other problems. Complementary, alternative or traditional medicines can be there. There are many complementary medicines are there, particularly in India, China, Africa. There are many complementary medicines are there. Many Ayurvedic preparation in India, particularly again, if you read pharmacognosy, you will find that Arjuna terminal Arjuna or Arjuna wrist or Arjuna preparations are very common. That is in India, Himalaya drugs produce one drug that is called as Abana tablets. They are very famous for hypertension. Patanjali produces that is Divya Muktavati. Like many such herbal preparations are there and they are known. So what will be happening in this? Let us see further what so let us see how these algorithms are there. One by one we shall see. Now we are diagnosed the hypertension. We have seen that hypertension is there. We have seen the table accordingly. Then first thing immediately has to be done in any case of hypertension is a lifestyle advice. We have seen what are the lifestyle advice: salt reduction, sugar reduction, oil reduction. All these things are there. We call it as a lifestyle advice. They are important. Now then we have got the categorization. If it is a grade 1 or grade 2, grade 1 is BP is around 100, less than 160, and diastolic is less than 100. This is will call as a grade. And the grade 2 is blood pressure is more than systolic is more than 160 and diastolic is more than 100 mm. So this is what we call as a grade 1. What we will do here, essential is here in both case optimal and essential are same. That is immediate drug treatment in high risk patient. What are the high risk patient? Already those who are having, we have seen all various risk factor. It can be cardiovascular, it can be means already having angina, having heart failure. These are all the risk factors, or having diabetes, having other problem. So these are various risk factor. Kidney problem, diabetics, or having any kind of hypertension mediated organ damage is there, HMODs are there. So in that cases immediately we have to go for treatment. Why? Because simultaneously we have to prevent the other consequences of CVD, CKD, diabetes, etc. Same is the case with the grade 2. Now in essential, how many drugs you have got? You have got many drugs. Now why it can be limited? In case some drugs, some people are allergic, some people have problem with one or other drug, then in that case if there is no one, then go for the treatment from the low to moderate risk patient and accordingly go for various drugs. We shall see which drug we are going to select. We shall have another. This algorithm is only about what are the treatment planning you are going for. Then those which are having lower risk, you initially try with the lifestyle intervention for 3 to 6 months, but if the BP is still not controlled, then go for treatment and go for the mildest treatment which is there. Okay. Now what are your goals? Always in that you work with the goal. Whenever you are working in pharmacotherapeutics, you work with the goals. What are your goals? Now your essential goal is to target the blood pressure reduction by at least 20 by 10 mm of Hg. Ideally it should be less than 140 to 90, which is there. So it is your most essential goal that the blood pressure should be at least reduced by 20 systolic and 10, that is 20 systolic and 10 diastolic mm of Hg. And if you can make it to less than 140 systolic and less than 90 diastolic is the best thing. What are the optimal? Now depending on various cases, because if it is less than 65, then what is your BP target? If it is more than 65 years, what will be the target and what it can be there? Again, drug tolerance, etc. You have to check everything, and then you will see that optimally you are trying to reduce it up to certain level, and then this is your goal. So these are your goals. You are making these goals. Why you are making the treatment? Just like why you are coming to PharmD, that some you have goal, some that you are going to become a drug experts. So what is because of this drug expert? Because of that you can find better job in this or this or this particular situation or organization. You did not take PharmD course for going into formulation or because you are not studying much about formulation. Your basic aim is to go in a clinical type of setup. So your goal was clear, and accordingly you taken a step to go for PharmD course. So similarly, the goal is clear. You understood the problem. Problem is what? That hypertension is there. Hypertension may be because of one or other reason if it is secondary, and what you are doing is that hypertension is resulting into various kind of consequences to what we call it as HMODs, that is hypertension mediated organ disorders or organ diseases. So these organs problems are there. To avoid this, you are going for treatment. So your aims are there. Your first aim is what? Reduce BP control. But if you remember, I told in earlier class that whenever you are going for BP control, your long term aim is what? To save the life of person, to increase the lifespan of the person, or to reduce the mortality which is occurring after certain years. I gave you example that even chlorothiazide is found to be of a best one, although it may not be reducing blood pressure too high, but it has been found to increase the life of the person, or it has found to reduce the mortality in the persons with the consequences or complication or HMODs from the patients. Then next is what we should go, what should be the things. Now we will go for whatsoever drugs which are available. We shall see how to use it. Okay. So what are the essential things? Now we understood that treatment is essential. Then what will do it? So use whatsoever drug which is best for that particular condition. Use the pre-combination if the drug are not available in single format, then go for that. Then use thiazide derivative if thiazide derivatives are not available, because I told you thiazide is the first, always first recommendation, or it is the first line in. Use alternative to dihydropyridine CCBs if these are not available or if they are not tolerated in persons. So what we start with? Usually we go for SPC, that is single pill combination therapy, ideally. Okay. Now again we shall study about this later when we will go for another chapter, that is rational drug, and we have to see that whether these are combination are rational or not. So single pill combination, if possible, it should be there. What are the combination available in single pill? There are many, like beta blocker plus calcium channel blocker, or ARBs plus calcium channel blocker, etc. There are many such single pill combinations are available. What do you mean by single pill combination? That is, two drugs are combined in one particular tablet, so person need not to go for two tablets. But always we do not go for single pill, because it will depend on combinations. Rather we will start with the thiazide first, and if required then we will go for another drug, or if we feel then we can go for that. Now we have got abbreviations for that. We will go for dual low dose of combination, then dual full dose combination, then go for triple combination step 3, and then step 4 is where it is a resistance hypertension, again go for additional one. Now what it is? We have abbreviated the drug A, B, C, D like that. Okay. So A means what? A are always adrenal receptor drugs which are there. Okay. Then C are calcium channel blocker, D are diuretics. Now we will see what are AC inhibitors. So first choice is AC inhibitor or ARBs. So AC inhibitor plus calcium channel blocker. Here also AC inhibitor plus calcium channel blocker. When third drug is there, then this AC inhibitor, calcium channel blocker plus diuretic. And if it is not working, then add spironolactone into it. So these are various treatment, AC inhibitor, then calcium channel blocker, and D means diuretic, particularly thiazide type of diuretics. These are very common, they are usually prescribed, and these are the first line treatments depending on the cases, depending on the situations. Okay. So treatment should be evidence based in relation to the mortality prevention. So what do you mean by evidence based? Again, you have got whole chapter in your 4th year, we call it as a evidence based medicine. What do you mean about evidence based? Evidence based means all the studies, various studies are taken, they are observed, they are studied. In earlier one I had shown you one research paper about these evidences, and on that basis these evidences are checked, they are verified whether this evidence show what kind of thing. I told you all the evidences suggested that the thiazide may be not reducing blood pressure, but they are reducing the mortality much. So since they are reducing mortality, this is actually important than reduction in the blood pressure and morbidity. So thiazide therefore are always in a first role, even though they are not officially you have studied as antihypertensive agents. Once a daily regimen which provide 24-hour blood pressure control should be there. It should not be happen that in morning you have given tablet, it will control it for 3 to 4 hours, then in afternoon 2 o'clock, 3 o'clock again there will be more rise of blood pressure. At some time it can be, we call it as a rebound rise. Just like ball, we have press for spring, we have press for some time and we release the pressure, the spring causes bouncing back. So it should not happen. So that regimen should be such a day that it should control the 24-hour, or it will be much appropriate if it can control 24 hours in a similar manner, no ups and downs. These ups and downs are very dangerous because it goes down, then at that time blood pressure is somewhere near normal, near control, all of a sudden it shoots up. So body cannot cope up with that. It can be more dangerous to have such kind of fluctuating blood pressure than this. Even sustained hypertension is somehow better because body tries to cope with it, but here it goes down, it suddenly increases, again goes down. So these cycles are not good. Treatment should be affordable and it should be cost effective. For this whole subject you have got, we call it as a pharmacoeconomics and pharmacoepidemiology. These two subjects will help you to this is a common topic, that is epidemiology and epidemiology and pharmacoeconomic. So these subjects will give you idea in future that how it is important. So the cost of the tablet or cost of the treatment and cost of the disease, everything is calculated. So it should be affordable or cost effective. Treatment should be well tolerable and it should not be causing many adverse effects. The evidence of benefit should be visible, it should be checked. It should not be that we are giving tablets, we are finding that yes, there is a reduction in blood pressure, but what has happened to various organs, it has to be checked. So benefits are important, benefits should be there. Now there are various conditions and we have to see that what has to be done. One more important concept you will learn, that is called as adherence. Any adherence means sticking to that particular treatment, that is called as adherence. Adherence means there are many things which are there in adherence. What is adherence? Suppose doctor has prescribed 20 milligram of one tablet in morning, one is in afternoon, one is in the evening. So when it is 3 tablets per day, that means why these 3 tablets are prescribed? Because we have seen it in pharmacokinetics that means that the pharmacokinetically the high is coming within half an hour or 1 hour and it is going down within 2 to 3 hours, and therefore after 3 hours you need to go for another, or after 4 hours you need to go for, because now the plasma concentration of drug has reduced. So doctor has got this information because pharmacokinetics of the drug is showing like that, the information is available, and from that information doctor is prescribing thrice a day. Now patient either make it as a 4 times a day or 2 times a day or once a day. Sometime the patient says that I forgot morning tablet, now I will take 2 in afternoon or I will take 3 in the evening. So this is not adherence, or this is not compliance, we call it as a non-compliance. When persons stick to the treatment for all kind of directions, whatsoever direction is there, take medication at this time, this much tablets, this much dose, take with this, don't take with this, suppose take with food, do not take with food. So all these things are important, these all things should be there, and if these are not there, then it will affect. Then next is consider the strategies to improve the adherence. Reducing polypharmacy. What is polypharmacy means? If simultaneously we are giving 3 tablets, where combination is available. So when combination is available, a person will have to take only one tablet. While if you are not using this, we call it as a fixed dose combination. If you do not give this combination, you will have to prescribe 3 tablets. Maybe tablet one for ARBs, another is for CC, that is calcium channel blocker, third one is for maybe diuretic. Now 3 tablets if you are prescribing, then the problem is what? The person will have to remember 3 tablets. Sometimes one is twice a day, one is thrice a day, one is once a day. Then there is a chance that patient will tend to forget it, and therefore as far as possible reduce the polypharmacy, use the single pill combination. Once a daily dosing or multiple is better than the multiple time dosing. Then check the daily habits, go for checking verification, try to get the feedback from the patient, kab tablet lete, kitne lete, how it was taken, so that you will understand during that feedback what it is there. Try to get home BP monitoring, that BP is monitored. So the doctor will get the idea whether the blood pressure is coming in control or not, or we are prescribing 3 tablets, the person is not taking as given or as indicated, and there are very much fluctuations are happening. Sometimes it is going much below even the normal, or can cause even problem, that is we call it as a hypotension, which can be very dangerous. It is more dangerous than hypertension. Or sometimes it is taking no tablet and therefore blood pressure is shooting like anything. So it makes the 2 week fluctuations if it is not there, and therefore it is there. In many countries there are apps are developed, so that along with that it is attached to the mobile phones, and this app will secure the data, and if it is a situation which is not good, then it may give this information to the doctor or the hospital. So like that it can be there. These are the very important one. Common and other comorbidity and complications of hypertension, we have seen it earlier also. There are many simultaneously there. Because of that, it can be coronary artery diseases, it can be stroke, it can be kidney diseases, it can be heart failure, it can also COPDs, that is respiratory problems are there. So in that conditions, what kind of drugs you will be using, that is very important, because these drugs accordingly we have to go for, and we'll go for this guidelines are there. These guidelines will suggest what are there. So what are the common comorbidities? Hypertension is having comorbid, or comorbidity means means simultaneously, means along with, morbidity means illnesses which is making patient confined to bed, or this is called as a morbidity, or not allowing person to work in a normal fashion simply. So what are the common comorbidities? One morbidity is what? Hypertension. Another is what? Coronary artery disease. So both are existing together, we will call it as a comorbidities. These are the terms. Being a first year of the therapeutics, I am explaining this term. This will be forever, you will have to go for. Every time these terms will be used by you, or you will encounter, or you will see these terms many times. So what are there? These are various conditions. And what are the treatment? Usually renin-angiotensin system blocker, that is angiotensin blockers, or calcium channel blocker are prescribed. They are first line. Lipid lowering agents, if the lipid is high in that patient's, antiplatelet treatment, again if it is there like aspirin etc., they are routinely recommended. If stroke was there, then various lipid lowering agent, antiplatelet, same as usual, and RAS blockers are there. In hypertension and heart failure, which are drugs? Again RAS blocker, that is renin-angiotensin system blocker, that means what? ACE inhibitors and ARBs. You know now, I will not explain again. ACE inhibitors, you know, all the prils, and ARBs, both are coming under RAS blocker category. Beta blockers and various mineralocorticoid receptor antagonists, that means spironolactone. These are various agents, they are used in heart failure. We have seen these drugs earlier during heart failure also. So spironolactone or these are what we call it as a potassium sparing diuretics. They are important in that. Then we have also seen about ARNIs, that is angiotensin receptor neprilysin inhibitors, that is sacubitril and valsartan. These agents are also very popular and they are found to be very effective in kidney diseases, where this kidney diseases are categorized on the basis of how much is the glomerular filtration rate. So as the GFR decreases, or E means estimated glomerular filtration rate is reduced, so that means that the kidney is not functioning normally. So in that also RAS inhibitors are the first line drugs, and then calcium channel blocker and diuretics can be given. Then when hypertension is along with the COPDs, then it is the most frequent comorbidity in the patient with the COPDs. Here BP should be lowered to 140 and treatment to the target of 130 to 80. So first way is, again in all cases lifestyle changes are important. Then treatment here first will be angiotensin receptor blockers, that is 81 are the first choice. Here we are not, if you remember, we are not using the AC inhibitor. Why? Because we have seen AC inhibitor, because of the bradykinin metabolism, they causes cough. This is what the basic knowledge you have got from pharmacology, that AC inhibitors are prone to cause cough. Here also there is a cough. Now we cannot use this, but we can use ARBs which do not produce this kind of activities. Okay. Now people will ask, or even I can put the question if I am the examiner, that person is got bronchial asthma and we are prescribing any of the AC inhibitors, then you should immediately change the treatment. You know, in USA what are the roles of pharmacists? They can check out, they can point out the problems or mistakes in the prescription, and we call it as a pharmacist intervention. So you should be equipped enough to have the pharmacist intervention. You should know that yes, in that condition this drug will not be useful, this drug cannot be given because it is prone to cause side effect. So what are the drugs we are giving? 81 blocker, that is ARBs, then calcium channel blocker, diuretics, etc. are given. Then in HIV AIDS also we can have CCBs. We cannot use CCBs because there may be many drug interaction with the CCBs, and it should be similar to general hypertensive populations are there. So these are the situations, and simultaneously we can check other diagnostic activities, and in that what we can give. So there are many such situations are there, and accordingly we can go for that. There is one important thing that is called as a metabolic syndrome, where people may have diabetes and other atherosclerosis and hypertension together. We call it as a metabolic syndrome, or we also call it as a syndrome X, which is very dangerous trio: hypertension, diabetes and atherosclerosis, which are very prominent, which can definitely going to lead, for if it is not treated timely, they are definitely going to lead a very severe cardiovascular or cerebrovascular problems, stroke or cardiovascular problem. So these are various situations, and in all conditions what drug we are going to use we can have. So most of condition we are preferring RAS and CCBs along with the thiazide diuretics, or thiazide in the first case if it is normal one. Then another problem is the resistance hypertension. The blood pressure is more and it is not getting cured with the normally the first line treatment which we are having. So in that cases we have problem. Okay. It is blood pressure which is more than 140/90, and the patient is treated with the 3 or more antihypertensive medications with their optimal or maximal doses, and still the person is showing blood pressure. So that can be then treated in different way. You need to, because why we need to treat blood pressure, we know that it has got many consequences, and it can lead to patient in any other we have seen, that is HMODs, that is hypertension mediated organ diseases or problems. So we should go for that treatments. Then we should try for checking about secondary hypertension, what kind of secondary hypertension person can have, and these are because of certain reasons. We shall see various reasons what these are. So example of secondary hypertensions are what? These are the renal parenchymal disease, that is kidney failure, and who are the prone person? These are the personal or familial history of CKD, genetically these are there. Then you are going for various tests, kidney function tests we call them, and various other diagnostic tests like ultrasonography or such tests people are doing, and on that basis go for it. Then primary aldosteronism, that is aldosteronism is increased. Then renal artery stenosis, again there are because of many other conditions. Pheochromocytoma, that is the tumor of adrenal medulla. We know adrenal medulla is secreting adrenaline, noradrenaline, and it is acting like a hormone. When there is it is acting like an endocrine gland, and whenever there is a tumor, that means there is increase in the size and number of cells are increased, and in that condition of pheochromocytoma, there is a more release of adrenaline and noradrenaline. You know what are the effects of adrenaline, noradrenaline. You have studied it in ANS, and you have studied it in various drugs acting on cardiovascular system. So because of beta 1 it will cause increase in the heart rate, because of the alpha 1 it will cause hypertension, and because of that beta 2 it may cause vasodilation. But you have seen Dell's vasomotor reversal, that the alpha effects are more prominent, they are faster, and beta 2 effect is not that prominent. Therefore you will able to see these effects, and their patient will be having hypertension. So this will be the situation. Then Cushing syndrome is because of the increase in the glucocorticoid. You might have studied Cushing syndromes in endocrine system, where because of the increase in the adrenocorticosteroid hormone, there is a increase in release of glucocorticoids, and because of that there is a disease. Sign symptom, you might have seen even photographs in tortora when you have studied endocrine system. Then coarctation of the aorta, and particularly aorta has got some anatomical deformities, and therefore high blood pressure is there in the upper area, upper portion than the lower extremities, and therefore in femoral, that is in leg, some pulses they become absent. Then obstructive sleep apnea, that can cause increase in the basal metabolic index. It causes snoring, it causes daytime sleepiness because enough sleep is not there. Then thyroid diseases are there in that, hyperthyroidism, because whenever there is a hyperthyroidism, we have seen it earlier also, it causes sensitization to sympathetic system. So more thyroid is there, because of that more sympathetic tone is there, or more sympathetic activity is there, and that causes problems. So these are various things. Plus we have discussed earlier about gestational hypertension, pre-existing hypertension, plus superimposed gestational hypertension with proteinuria, preeclampsia. These few terms we have seen earlier. Preeclampsia is there along with proteinuria, and it is very dangerous situation. Earlier diagnoses were not available, and many females were dying because of that. Fetal growth retardation, preterm birth, there are many problems were there because of this eclampsia, preeclampsia and eclampsia. This eclampsia will also simultaneously may lead to seizures and severe headaches, and immediate treatment and delivery is required in that cases, otherwise the female may die in that. And these are very important situation in pregnancy. So most of these are the pregnancy related hypertensions, and then they are to be treated. We have seen it earlier. Okay. So we have seen it earlier that what are the problems. So these are situations. We shall see other things in next time, what we call as a hypertensive emergencies, and what are the other situations. So I hope you are getting this. These are all various guidelines. Please, you can download this. These are available. You can put this title into this Google search, it will be available. 2020 International Society of Hypertension Global Hypertension Practice Guidelines, a very good article, and it will be easy to read also. It is very easy to understand also. So you please go through this article, good article, and